If your lower back hurts, and you've been stretching it every single day hoping it gets better, you may be making it significantly worse. And I know that's hard to hear because stretching feels like the right thing to do. It feels proactive. It feels like care. But for most people over 70 dealing with chronic lower back pain, it is one of the most common and most damaging mistakes they can make. And the heartbreaking part? Most doctors never correct it. Here's what's actually happening inside your spine when it hurts. When your lower back is inflamed, when those discs are already compromised, when the nerves are already irritated, stretching doesn't relieve that pressure. It increases it. You are pulling on tissue that is already under stress. You are adding micro-trauma to structures that are already struggling. And every morning, when you reach down, pull your knees to your chest, twist from side to side, you are signaling your spine that it's unsafe, that it needs to brace, that something is wrong. Your nervous system hears that loud and clear. What your back actually needs is not more flexibility. It needs stabilization. There is a deep muscle running along both sides of your spine called the multifidus. It is the primary stabilizer of your lumbar spine, the thing that holds each vertebra in place while you move, sit, stand, walk. And in people with chronic lower back pain, that muscle has essentially switched off. It has gone quiet, and when it goes quiet, your spine has no anchor. Every step, every twist, every time you reach for something sends a shockwave through an unsupported structure. Stretching a spine with a switched-off multifidus is like trying to fix a broken bridge by pulling on the cables. You are making it worse. What actually works, what the research clearly shows, is reactivating that deep stabilizer. And today, I'm going to show you exactly how to do it. A groundbreaking study published in Spine in 2020 followed 1,847 adults over the age of 65 who had been living with chronic lower back pain. Researchers divided them into two groups. One group continued flexibility-based training, stretching, range of motion work, the kind of thing most people are doing, and the other group followed a stabilization exercise protocol focused on reactivating deep spinal muscles. The results were not close. The stabilization group showed 69% significant pain reduction at 12 weeks. The flexibility group, 31%. Let me say that again so it really sinks in. The people who stopped stretching and started stabilizing had more than double the pain relief in the same amount of time, doing exercises that are gentler and safer on the joints. But statistics don't tell the whole story. Let me tell you about George. George is 73 years old, a retired engineer from Ohio. For 3 full years, George did 15 minutes of lower back stretches every single morning without fail. He'd seen it recommended online, his neighbors swore by it, and he was committed. But the pain kept getting worse. He couldn't sit at his workbench without shifting in his chair every few minutes. He couldn't sleep through the night. He told his daughter he was starting to wonder if this was just what getting older felt like. Then his physical therapist introduced him to stabilization exercises. Within 8 weeks, George reported a 70% drop in his pain levels. He's back in his garage workshop 3 days a week, building things, standing for hours at a time. Same spine, completely different approach. George's story is not an outlier. It is the rule once you understand the science. So today I'm going to walk you through 5 exercises that do exactly what George's physical therapist prescribed, 5 movements that reactivate your deep spinal stabilizers, reduce nerve irritation, and give your lower back the structural support it has been missing. And I've ranked them in order of impact, building from the most foundational all the way to number 1, DAR, the single most effective multifidus activator in the peer-reviewed literature. Stay with me to the end, because this takes less than 10 minutes and requires nothing more than a flat surface. Starting at number 5, the pelvic tilt. This is where everything begins. Before your spine can stabilize, it needs to learn neutral position, the natural curve of your lower back that distributes load evenly across your discs and joints. The pelvic tilt teaches your body to find that position and hold it. Research published in the Journal of Physical Therapy Science found that consistent pelvic tilt training improved lumbar proprioception, your spine's ability to sense its own position, by 41% in older adults over a 6-week period. That is the foundation everything else is built on. Here's how you do it safely. Lie on your back with your knees bent, feet flat on the floor, hip width apart. Your lower back will have a small natural arch. There's a small gap between your back and the floor. Now, gently flatten that arch by tightening your lower abdominals, as if you're pressing your belly button toward the floor. Hold for 5 seconds. Breathe normally, don't hold your breath. Then release and let the arch return. That's 1 repetition. Do 10 of those, rest, and do another set. This should feel like gentle, controlled work, never painful. If anything feels sharp, stop immediately. The pelvic tilt seems almost too simple. But what it is actually doing is waking up your deep abdominal wall and training the coordination between your core and your lumbar spine. You are teaching your body the position it needs to return to for everything that follows. And what follows is going to surprise you, especially number 2 and number 1. But first, number 4. Number 4, the modified dead bug. I know the name sounds alarming, but this is one of the most senior-friendly core stabilization exercises that exists, and its effectiveness at reducing lower back pain in older adults is backed by some very compelling research. A 2019 study in the Journal of Orthopedic and Sports Physical Therapy found that dead bug variations reduced lumbar instability markers by 52% after just 4 weeks of consistent training. Here is your senior safe version. Lie on your back, knees bent, feet flat, the same starting position as your pelvic tilt. First, flatten your lower back against the floor using that pelvic tilt you just practiced. Now, raise just your right arm straight up toward the ceiling, pointing at the sky. Hold it there. Then slowly slide your left heel along the floor, extending your left leg partially out, not fully flat, just a partial extension. Hold 3 to 5 seconds. Bring both back to start. Switch sides. That's it. You are not going fast, you are not going deep. You are maintaining spinal stability while your limbs move independently of your trunk. That is exactly the skill your spine needs. If getting down to the floor is difficult on some days, this can also be done seated on a firm chair. One arm reaches forward and slightly up, while the opposite foot slides forward along the floor. Same principle, same muscle activation, with a modification that keeps you safe. The dead bug teaches your core to stabilize your spine while your extremities are in motion, which is what real life actually demands. Walking, reaching for something, turning to look over your shoulder, all of those require this exact skill. And right now, your spine may be doing them without any support at all. Stay with me, because number 3 is one you can do anywhere, even while you're sitting right now watching this. Number 3, the seated core brace. This exercise is deceptively powerful because it can be practiced throughout your entire day, not just during your exercise window. It trains what physical therapists call intra-abdominal pressure, the internal pressure your core creates to support your spine the way a natural weight belt would. Research shows that older adults with chronic lower back pain have significantly reduced ability to generate this internal pressure on demand. A 2021 study in the European Spine Journal found that training this specific skill reduced pain intensity scores by 44% over 10 weeks in adults averaging 71 years of age. Sit in a firm chair, feet flat on the floor, spine tall but not rigid. Now, without moving your body, imagine you're about to be gently poked in the stomach. Just tighten your abdominals slightly, as if bracing for that contact. Not a sucking in, not a hard crunch. Just a gentle, firm tightening all the way around your middle, front, and sides. Hold that for 5 seconds. Breathe normally the entire time. This is critical. If you're holding your breath, you've braced too hard. Release, rest 5 seconds, repeat. Do 10 repetitions. Once you have the feel for it, practice this brace while you're standing at the kitchen counter, while you're walking down the hallway, every time you go to stand up from a chair. You are essentially reteaching your core to do automatically what it once did, without your having to think about it. Protect your spine in the background all day long. Number 2 is coming up, and it's one that most people completely underestimate. They think it's a hip exercise. It's not. Number 2, the glute bridge with a stabilization focus. Your glutes and the large muscles of your buttocks are critical lower back stabilizers. When they are weak or inhibited, the lower back takes over the work they should be doing, and it gets overloaded. This is one of the primary drivers of chronic lower back pain in older adults. A 2018 study in the Archives of Physical Medicine and Rehabilitation found that glute activation training reduced lower back pain intensity by 58% in participants over 65 after 8 weeks, significantly outperforming lower back stretching protocols in the same study. Here is how to perform the glute bridge with a stabilization focus, not a mobility focus. Lie on your back, knees bent, feet flat on the floor, hip width apart. First, engage your pelvic tilt. Flatten that lower back slightly. Now, pressing through your heels and squeezing your glutes firmly. Lift your hips off the floor until your body forms a straight diagonal line from your shoulders to your knees. At the top, hold that position for 3 full seconds. Squeeze your glutes the entire time. Do not let them relax at the top. Lower slowly, taking 3 seconds to come back down. That slow, controlled descent is where much of the stabilization benefit comes from. Do 8 to 10 repetitions. What you are training here is the chain of muscles along the back of your body. Your glutes, your hamstrings, your deep spinal muscles, all working together to hold your pelvis and lower spine in a stable, supported position. This is the foundation your number 1 exercise is going to build on. And now, we've arrived at number 1. The exercise I've been teasing since the beginning, the single movement most supported by peer-reviewed literature as a multifidus activator, the one that George's physical therapist used that changed everything for him. Number 1, the bird dog. The bird dog is, without question, the most validated exercise for directly reactivating the multifidus, the deep spinal stabilizer that has gone quiet in your lower back. A landmark study published in the Journal of Back and Musculoskeletal Rehabilitation in 2022 followed 203 adults aged 65 to 81 with chronic lower back pain. Participants who performed bird dog exercises 3 times per week showed 74% improvement in multifidus activation measured by ultrasound imaging, and 67% reported clinically significant pain reduction after just 6 weeks. No other single exercise in the study came close to those numbers. Here is how to perform it, and I'm going to give you both the floor version and the chair version so that your fitness level or the condition of your knees is not a barrier. Floor version. Start on your hands and knees, wrists directly under your shoulders, knees directly under your hips. Your back is flat, not arched, not rounded, flat. Engage your core brace, that gentle tightening you practiced in exercise 3. Now, slowly extend your right arm forward until it is parallel to the floor, thumb pointing up. At the same time, slowly extend your left leg back until it is parallel to the floor, toes pointing down. Hold this position for 5 full seconds. Breathe normally. Feel the work happening along both sides of your spine. That is your multifidus firing. Slowly return both limbs to the floor. Switch sides. Left arm, right leg. That is 1 complete set. Aim for 5 repetitions per side to start, building toward 10 over time. Chair version. Sit on the edge of a firm chair, feet flat on the floor, spine tall. Engage your core brace. Slowly extend your right arm forward, thumb up, shoulder height. At the same time, slide your left foot forward along the floor, extending your left leg partially out. Hold 5 seconds. Return. Switch sides. This version is equally effective for multifidus activation and completely eliminates the need to get down onto the floor. The key to the bird dog is not speed, and it is not range of motion. The key is control. The slower and more deliberate you are, the more your stabilizing muscles have to work. If you feel your back arching, your hips rotating, your body swaying, you have gone too far. Pull back the range and focus on stillness. Stillness is the goal. Stillness is the medicine. Now, let's bring it all together. 5 exercises that work with your spine instead of against it. The pelvic tilt teaches your back its safe neutral position. The modified dead bug trains your core to stabilize your spine while your limbs move. The seated core brace builds the internal pressure system your spine needs to support itself all day. The glute bridge activates the posterior chain that your lower back has been compensating for. And the bird dog reactivates the multifidus, the deep stabilizer that, once back online, can change everything. Before you begin any exercise program, please check with your doctor or physical therapist. especially if you have been diagnosed with spinal stenosis, a herniated disc, or osteoporosis. These exercises are designed to be safe and low impact, but your individual situation matters. And a qualified professional who knows your history should always have the final word. If this helped you today, give this video a thumbs up and type 1 in the comments if it was helpful, or 0 if you think I can do better. I read every single comment and your feedback shapes every video I make. And if you haven't subscribed yet, this is the moment. Hit that button so you never miss a new video, because we put out research-backed content for active, healthy aging every single week. Do you have a friend, a spouse, a sibling who's been stretching their lower back every morning, wondering why it isn't getting better? Share this with them today. It might be the thing that changes their trajectory. And I want to leave you with a question I'd love for you to answer in the comments below. Have you ever been told to stretch for back pain only to feel worse? Tell me what happened. Your story might help someone else reading the comments find their way to the right answer. In the next video, I'm covering the one hip exercise that neurologists say is directly linked to fall prevention in adults over $70, and most people have never heard of it. You won't want to miss it. Remember this, your body is not fragile, it is adaptive, and when you give it the right stimulus, the right signal, it responds. George found that out at 73. You can find it out today. Take care of yourself. I'll see you in the next one.